Second white coat. Subscribe and like. Let's learn medicine together.
Today, we've got a real medical detective story for you. We're looking at a single patient, a single injury, and a set of symptoms so strange they seem to completely contradict each other. But here's the thing. Inside this puzzle are all the clues we need to crack the case. So let's set the scene. It all starts in the emergency room. A 21-year-old guy comes in after a fight, and he's got a stab wound on the right side of his neck. Now, he's stable, he's awake, but when the doctors do a neurological exam, they find something really, really bizarre. And this right here, this is the heart of the mystery. Just look at this. On the right side of his body, the exact same side as the injury, he can't move his leg and he can't feel a vibrating tuning fork. Okay, but then on his left side, the opposite side of the injury, he can't feel a sharp pinprick or tell the difference between hot and cold. I mean, how is that even possible? So that's the big question, isn't it? How can one single wound on the right side of his neck cause paralysis on the right, but a loss of pain sensation on the left? To figure this out, we need to take a look under the hood at the body's incredible wiring. The best way to think about the spinal cord is like an information superhighway. It's not just one big cable, it's this bundle of different pathways, or lanes, and each lane carries a very specific type of signal. Now, the key to our whole mystery is that not all these lanes are wired up the same way. But don't worry, for this case, we only need to focus on 3 of them. First up, we've got the corticospinal tract. You can think of this as the main motor lane. It's the express route for commands coming down from your brain telling your muscles what to do. Pretty simple. Brain says, kick a ball. This is the lane that carries that message to your leg. Next, we have the dorsal columns. This is a sensation lane, but it's for very specific feelings. It carries signals for things like fine touch, vibration, from that tuning fork, and something called proprioception. That's basically your brain's amazing ability to know where your arms and legs are without you having to look at them. And our third and final lane for today is the spinothalamic tract. This is the body's alarm system. It's the pain and temperature lane. So it carries signals for things like a sharp pinprick or touching something hot or cold. Okay, so now we know our 3 key pathways. Let's start solving this case, one clue at a time. All right, clue number 1, the patient can't move his right leg. That's paralysis on the same side as the stab wound. This points us directly to our motor lane, the corticospinal tract. But the real question is, why on the injured side? So what's fascinating is the route these motor signals take. They start in your brain, sure, but they cross over to the opposite side way, way up in the brainstem. That means by the time those signals are traveling down your neck, they are already on the same side of the body they're going to control. So if you injure the right side of the spinal cord, you knock out the motor signals for the right side of the body. Boom! Clue number 1 is solved. Let's move on to our second clue. The patient can't feel vibration or sense where his right leg is. And again, this is happening on this same side as the wound. This is starting to feel familiar, right? It points us straight to our second pathway, the dorsal columns. And it turns out the wiring is almost exactly the same as the motor pathway. The signals for vibration and proprioception travel up the spinal cord on the same side they came in on. They only cross over when they get all the way up to the brainstem. So just like before, a right-sided injury in the neck takes out the right-sided sensation signals. Okay, 2 clues down, a clear pattern is forming. But now, get ready for the twist. And here it is, the one clue that seems to break the entire pattern. The patient has lost pain and temperature sensation on his left side, the complete opposite side of the injury. This has to involve our third lane, the spinothalamic tract. So how on earth does a right-sided wound cause a left-sided problem? Okay, so here's the secret, the crucial piece of the puzzle. The spinothalamic tract is wired completely differently. Unlike the other 2, when pain and temperature signals enter the spinal cord, they don't wait. They cross over to the opposite side almost immediately, right there in the cord, and then they travel up to the brain. And this one unique bit of wiring, it explains everything. And this slide shows us exactly how that solves the paradox. A pain signal from, say, the left side of the body enters the left side of the spinal cord, but it instantly crosses over to the right side to travel up to the brain. That means the right side of the spinal cord is actually carrying pain signals from the left side of the body. So if you damage the right side of the cord, you lose pain sensation on the left. Mystery solved? So now we've got all the pieces. A single injury that slices through just one half of the spinal cord on the right side. Let's see how this one event creates that really unique pattern of symptoms our patient has. This classic clinical picture, this unique neurological fingerprint, actually has a name. It's called Brown-Séquard syndrome. It's precisely what happens when exactly one half of the spinal cord gets damaged. And as you can see here, the injury diagram on the slide maps perfectly onto our patient's symptoms. Let's just quickly summarize it all one last time. The injury on the right side hits the corticospinal tract, causing same-sided paralysis. It hits the dorsal column, causing same-sided loss of vibration. And it hits the spinothalamic tract, which, as we now know, was carrying signals from the left side, causing opposite-sided loss of pain and temperature. It all fits together perfectly. But why does this all matter? Well, because this is so much more than just a fascinating puzzle for doctors in training. In a real-life trauma situation, understanding this wiring lets a doctor know exactly where an injury is just from a simple neurological exam at the bedside, often before any scans are even done. It becomes a diagnostic checklist. A doctor sees a penetrating wound, they check for motor and vibration loss on that same side, they check for pain and temperature loss on the opposite side, and bam, they can instantly and confidently identify that half the cord has been damaged. It's a powerful example of how knowing the body's blueprint leads to a super fast and precise diagnosis. And it really leaves you with a final thought. The logic of our nervous system is so precise that damage to just one half of this information superhighway can tell such a specific and detailed story. It kind of makes you wonder, right? What other secrets are hidden in our body's complex wiring, just waiting for the right set of clues to bring them to light?